So pay attention. There you go. Got a good show today on statins, pesticides, cell phones, and your heart. They all actually tie together. It'll be interesting for you. Mod's over there dancing, getting ready for the show. We get all pumped up for this show. #1 health and wellness radio show in the world.
81 degrees on Peachtree Street at News 95.5 and AM 750 WSB.
That's us.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease.
I have to watch a mod to tell me when to go
Discuss
on.
this information with your own physician or healthcare provider to determine what is right for you.
Hey folks, Dr. Joe here. So glad we spent a little time together. Thanks for joining us. Interesting topic today. Before the show, I always go meet with Ahmad, my producer, and we get together, and he always says, well, what's our topic today? And I said, it's going to be statin drugs, pesticides, your cell phone, and your heart. And he says, how do those all tie together? And I said, watch me. They all actually do tie together. And it's actually an important issue because my father died of heart attack, heart disease, probably all of you being affected one way or another of somebody who has heart disease. And there's a lot of things out there that you're not aware can actually be adversely affecting your heart. So just to clarify, don't change your medication. Always check with your primary doctors before you do anything. But I'm going to give you some new insights today as to what's going on. Now, before I do this, I have to tell a little story. I was out shopping, and I was at one of the big box stores. And there's a young kid there, a nicely dressed kid. He had a little table there. It was all set up with fall flowers and everything. And he says, hi, folks. We're doing flu shots today. Now, I'm not a big fan of flu shots. If you are going to do a flu shot, make sure you get it without mercury or preservatives in it. You can get those. You can order them separately. And he has on the table donuts and cookies and cakes and brownies. And they were giving you free donuts or cookies or cakes or brownies if you got your flu shot. And my first, this poor kid, I didn't pick on him too much, but my first thought was, what's the #1 thing you can do to like blow out your immune system? Eat sugar. So we're going to give you sugar to blow out your immune system and then give you a flu shot that's supposed to help your immune system. And I thought, how insane is this? And the people I were with said, but most people don't know that. And I said, yeah, you're right. I got to forgive them, for they know not what they do. And it was just an interesting twist that here we are trying to talk about flu shots and get people taking the flu shot, and yet we're going to give them the things that are going to make their immune system weaker and make them more susceptible to getting the flu. Now, I know you think, well, one brownie isn't going to do it, but still, I don't eat stuff like that, so I didn't take any. But if you do that on a regular basis, you're going to increase your risk of getting sick. So not really a good idea. So once again, I've done shows on vaccines. Again, I'm not a big fan. If you don't have to take them, don't. If you do take them, make sure they don't have adjuvants, it's called, like mercury in them. And also try to space out your shots. This is my opinion. I'm not a medical doctor. It's how I feel and research I've done. Because we've done studies on one shot, another shot, you can understand that. But there are no studies that I know of when the shots are combined. And that's where I start to see a lot of problems too. So that's up to you. But I digress. We're talking today about statin drugs, cell phones, pesticides, and your heart. 1 out of 4 Americans over the age of 45 is on a statin drug to lower their cholesterol. So the #1 drug I see in our practice is people take blood pressure medication. And then #2 is kind of tie, I guess I got to look at the national stats, but in my offices, it's tie between cholesterol medication and blood sugar medications, diabetes medications. And whenever I talk to my patients, I never hear them ever say, well, my doctor advised me what to do in addition to the medication from a nutritional standpoint, what I can do to get myself healthy, so hopefully I don't need to take the medication. Never heard them say that. Well, I guess that's our job, not theirs. Now, once again, don't stop taking your drugs. I'll say this several times throughout the show. Don't, because a lot of people tune in and out, by the way. Don't stop taking your drugs. However, I want you to consider other options you can do to hopefully get well enough or healthy enough so you don't need the drugs. Patients come to our house all the time and say, Dr. Joe, I want to get off my medication. And they name the medication. And I say, listen, I'm not here to do that. What I'm here to do is get you healthy enough so that you can get off the medication. So 1 in 4 Americans over the age of 45 is on a statin drug to lower their cholesterol. These drugs, they could be as bad as some of the evidence suggests, but they could be worse. Interesting. Stephanie Seneff, S-E-N-E-F-F, is a senior researcher scientist at Massachusetts Institute of Technology. She works at MIT. I'm guessing she's smart. she's an absolute treasure trove of information. She's really an interesting lady, and I've read her work, and it's really pretty cool in what she's come up with. And I just love the way she lays things out because I thought, oh, I like the way she thinks. Another doctor, researcher, another book that's entitled, this is by Dr. Dwayne Graveline, Dark Side of Statins plus the Wonder of Cholesterol. And so this talks about how important it is to have cholesterol in your body. And we're going to talk about that too today. You need to have cholesterol in your body. And one of the problems we're starting to see now in the healthcare field is people coming with too low cholesterol and leading to all sorts of neurological problems and hormone production problems, because you need cholesterol to build healthy nerves, to build hormones. Now, as a chiropractor, I'm very concerned about your nervous system. My job is make sure the message is getting from your brain down your spine out to your body and back up. And you need cholesterol in order to make the nerves work. It acts like a covering around the nerves, an insulator. And so if we lower the cholesterol too much, that becomes a problem. And I've never heard anyone say, gee, my doctor was concerned that my cholesterol got too low. So these are some things I want you to consider. And that's why sometimes you have to take control of your own health. And I'm not bucking the doctors, please understand. I refer constantly to other doctors. They refer to me every day. I think we're probably getting a referral or two from another doctor's or another healthcare provider. But I was at a doctor's office last week, and a urologist, and a very good urologist, Advanced Urology in Atlanta. I think they're great. And I was sitting there, and I just started talking. One of the nurses recognized me, and we started talking. And one of the sales reps, the drug sales reps, was there, and he and I started talking. And suddenly, I'm holding court. You have 35 people working in this one urology clinic, and people gathering around. Well, let me ask you a question about this. Let me ask you a question about that. And it's not that the doctors don't want to argue with these points. They just don't know it. They've never heard these points before. So it's really neat that the healthcare professions are kind of coming together now to help each other out. Now, as a chiropractor, my job is work on it from a holistic standpoint. I don't do drugs. I don't do surgery. If you need drugs or surgery, I send you to a doctor who does that. It's pretty easy to overestimate the benefits of statins by confusing people with absolute and relative risk. I want to talk about this because this is something that drives me nuts, because researchers use this all the time, absolute and relative risk, and you read it and go, oh, well, that's pretty important. So follow me on this if you can. You do a study which is the absolute risk and is very rare. Let's say 2% of the population is actually expected to have whatever it is they're monitoring, let's say heart attacks, okay? So 2%, 2 out of every 100 might have a heart attack. Then you look over a period of time and find that 2% of the control group has the occurrence they're looking for, in this case, heart attack. And the treatment group, let's say, has 1.5% instead of 2%. So people taking the medication have 2%. People not taking the medications, 1.5%. Follow that? So it's only a 0.5% difference in who has it and who doesn't. So that's a 0.5% decreased risk for the individual standpoint. But from their standpoint, that's a 25% improved performance. So what they're saying is a 25% difference, when in reality, it's only a 0.5%, because they're looking at the difference in the percentage, 2 versus 1.5. Folks, got to go to break. If you have a healthcare question, give us a call, 844-44-Dr. Joe, 844-44-Dr. Joe. I'm Dr. Joe Esposito. Don't go anywhere. We're going to be right back.
All right. How long do we have?
We have, what do we have? About 4 minutes, I guess, 4 or 5 minutes. So, hi, folks. Dr. Joe, glad you could be here. This is our little intimate little off the radio now. And so if you're watching on Facebook or Instagram, welcome. Glad you could be here. And my website, by the way, is drjoe.com. So if we can't get you in today with your question, you have questions, post them. And I have Garrett, Mr. Wonderful, behind the camera there. And he's taking my questions and giving them to me. I'll take callers as well. If you don't get on the air, if you don't want to have your question answered, just go to my website, drjoe.com, and send me your questions. Any questions yet, Garrett?
Not exactly a question, but this woman's talking about how it's hard because doctors tell us to take medicines and do things, and then years later you find out those things actually hurt you. It's confusing, it's frustrating, and how are you supposed to know what to do?
I agree 100%. It's extremely confusing and frustrating, not just to you, but to the doctors. You know, I was advanced urology, and I was talking to doctors there and the nurses there, and they just were, I mean, I couldn't leave. I was there for, I don't know, quite a while, and I said, I got to go, you know. It's really interesting because a lot of doctors don't know. Now, this is research. Who has ever read, Dr. Seneff's research and Dr. Graveline's research? I have, but most doctors haven't. And so they say, okay, this is what the drug is, this is what it does, this is when we apply it, and that's the standard. But you've got to spend a lot of time researching these things and gonna go behind the scenes. You know, as a chiropractor, of course, I research chiropractic on a regular basis, but I'm board certified in chiropractic, orthopedics, pain management, double board certified in nutrition, BS in nutrition, retired dietitian. I research every single day. There's not a day that goes by. I was researching before we came on the air today for this show, and I ended up putting together a whole nother show. So you have to find somebody who does the research, and that's a little tricky sometimes. Another question?
Yes, so I had a great one. This woman's daughter is 12 years old, and she's due for an HPV vaccine.
Yes.
What do you suggest she does?
Once again, I'm not a medical doctor. I can't give you medical advice. However, if it was my daughter, I would not give it to her because I see the side effects many, many times. Now, some people don't have side effects. I understand that. However, if it was my daughter, I would say no because HPV is a virus, just like it's a virus like the flu. Most of the time, if your body is healthy, you'll get HPV. Most people have been exposed to HPV. If you're an adult and you're active, chances are you've been exposed to HPV. But it's a virus and your body fights it. Now, there is a risk, a slight risk of what can happen if you don't, but there's also a slight risk if you get the flu. Not a big fan of flu shots either. So my opinion is talk to your daughter, advise her as to safe practices. And I'm not a big fan of the HPV virus because I've seen so many side effects from it. So.
I can actually speak on that when I was getting ready to go to college, I had to get the HPV vaccine.
Okay.
I got it. 5 minutes later, I was having a seizure in the waiting room.
Really? Wow. So I didn't even know that about Garrett.
Yeah. All right, next question. This person is on birth control to regulate hormones. I would imagine something like a cyst or...
Okay.
What would you recommend as an alternative for regulating your hormones?
Okay, 2 weeks ago we did hormones, or 3 weeks ago, yeah. So go to my website, drjoe.com, look under my archive radio shows. We have a whole 2-hour show on hormones. So it's more than I can answer in just this few minutes here, but that's why I needed 2 hours to do it. But I'm not a big fan of birth control pills either because of the potential side effects. Now I understand having a baby is a side effect too if you don't take the birth control pill. But you always have to research and read the little pamphlet that comes with any medication you take and read the side effects, and then you can decide what to do. But as far as balancing the hormones, please go to my website and listen to the whole show because I just can't give you a whole answer on that. So, not today.
And you're probably coming up on it.
1 minute. Tell me when it's 1 minute. Tell me when we have 1 minute. Okay. Real quick, 30 seconds.
Yeah, so I know you're probably about to get to this anyways, but what do you recommend as a replacement for statin drugs?
Okay, that's the whole show is about that. Yeah, okay.
Cool.
And I'm not saying don't take your statin drugs. Please understand that. That's your medical doctor's job. I want to get you to the point where you don't need the statin drugs. That's my goal. I got traffic coming up here, so after traffic, then I got to come back on the air. So keep your questions coming, though. We got Garrett there. And tell your friends, by the way. Call your friends, call your family, have them tune in as well. You could also listen on WSBradio.com if you want to listen, or on 750 AM and 95.5 FM.
Causing some heavy delays back to Loop Road at the airport.
To listen to the callers as well.
I'll listen to the callers too. That's true. Because unfortunately, when I start taking calls, you can't hear them.
Listen to Dr. Joe Esposito on News 95.
Hey folks, Dr. Joe here. So glad you could spend a little time with us today. We're talking today about interesting topics. We're talking about cell phones, statin drugs, pesticides, and your heart. What an interesting combination. So it's all gonna tie together pretty soon. And we were talking about Dr. Senif, her research on cholesterols, and now we're talking about Dr. Graveline and his research. He's passed away, unfortunately. And it's pretty easy, as we said, to overestimate the benefits of statin drugs. And we talked about how we can kind of jiggle the statistics a little bit. So if we have one group that's taking a medication and one that isn't, and 2% of the people have a heart attack, let's say we're doing heart attacks, in the people that are not taking the medication, and 1.5% of the group, 1.5 out of 100 are not taking the medication, they have a heart attack. So they say, oh my gosh, so there's a 25% reduction in your risk of heart attack. Well, yes, that's true. However, the raw numbers say 2 out of 100 got it if they took the medication. If they didn't take the medication, 1.5 had it if they didn't take the medication. So it's really only a 0.5% difference. But we're looking at a percent of the 2 versus 1.5. Statistical mumbo jumbo is what it boils down to. So that's why if you ever read something like that, and you're really have a boring life, you can go ahead and then look at the study and see what it really is. So it's a little tricky. And as a layperson, I look at it too, go 25% difference, 50% difference. That's a lot. Well, if 1 in 100 versus 2 in 100, your risk is there. And then you got to look at side effects. Are the side effects worth it? So let's start with statin drugs. Research now is showing, and somebody had called in and had a question about that. Research is showing that it may not be, this is early research now, that you're producing too much cholesterol. It might be that your body isn't recycling the old cholesterol. And that usually shows up when the liver is not working properly. If you get a fatty liver, the receptor sites for your cholesterol isn't being recycled properly. And so if you get on a good diet, again, you do what you want to do as far as your medication goes, what your doctor says, get on a good diet and clean out the liver, two things happen. Number one, you're on a good diet, so that's going to help the production of cholesterol. And then number two, if it cleans up the liver, the receptor sites open up, you start recycling the old cholesterol, and many times your cholesterol levels drop. Most times the cholesterol level drops. So that's the cool thing about this, is you can take control of your own health. And that's something that nobody's really doing. They keep saying, well, you have high cholesterol, let's put you on statin drugs. Statin drugs prevent you, we're going to talk about this, from producing something called coenzyme Q10 and other important nutrients. And so when we get to that, I'm going to talk about how you can start replacing the coenzyme Q10 as hopefully you start to straighten out your diet, get your liver cleaned up, stop putting the bad stuff in, let the liver heal, and let's see if we can naturally lower your cholesterol. In fact, one study I read said that 99 out of 100 people can alter their cholesterol by simply changing their diet. 1 out of 100 have genetically high cholesterol. Those people respond very well to statin drugs. The other 99, if you got to do the work, you'll be amazed what happens. So as a chiropractor, my job is make sure your nervous system is working properly, your digestive system is working properly, and you have a good diet. Where's my mouse? Can't find my mouse here. Oh well. My mouse is missing. I have a missing mouse. Okay, so Ahmad, you're going to have to give me the time here. Did you type it in yet? Okay. Okay, there it is. Okay, good, got it. Okay, sorry, folks, my mouse has disappeared from my computer here. So as a chiropractor, I want to make sure your nervous system is working, your digestive system is working, and you have a good diet. And if you do those three things, I am blown away. I've been in practice almost 34 years. I am blown away at how well people do. Because your nervous system controls everything. So you think of chiropractic as neck pain, back pain, shoulder pain, car accidents. If you've ever been in a car accident, if the car was damaged, you were damaged, you need to come see us. Whether it's 50 years ago or yesterday. The sooner you get to it, the better. But the nervous system controls the organs. So I have a pinched nerve going to my liver, my spleen, my kidneys, my prostate, my toenails. Those organs probably aren't working right if I pinch the nerve. But here's the thing that whenever I say this on the air, people come into my office the following week and say, I heard you say this on radio. 90% of your nerves don't feel pain. You don't feel your blood pressure. It's controlled by nerves. You don't feel your gallbladder, your spleen, your kidneys. So my concern with the patient is not only the nerves that feel pain, it's the nerves that don't feel pain. Because you can have a pinched nerve or damaged nerve and not know it. So many times patients come to us with health issues. They don't know what to do about it. They come see us for chiropractic care, and suddenly these other health issues that they didn't come to us for start to get better. My asthma got better. My bowels are moving better. My love life improved. I'm performing like I used to when I was younger. I'm pinching the nerves to the organs. So it's really important that you consider a holistic approach. I like chiropractic care, good diet, and good digestion. And a good diet, of course, means you're eating the right foods, which are a lot of fruits, vegetables, nuts, and seeds. Dr. Joe's Super Greens, Dr. Joe's Essential Source, the minimum amount of nutrients you should be taking every day. And that's going to help tremendously, giving the body the raw materials so that it can start to heal. If I want to grow a tomato, I have to have the right soil and the right fertilizer and the right seed and the right sunlight and the right water. Every cell in your body has certain requirements in order to make it work properly. And if you're not giving it the right nutrition, it's not going to work. And that's why I created Super Greens and Essential Source. They're 2 powders. I mix them with coconut milk or almond milk because it makes it taste a little better. And I shake it up and I drink it, and I have it with me all the time. I have some right here in the studio with me. And I take it at least once a day. Now, if I have a big day, if I'm going to do a couple of radio shows, lectures, if I'm traveling, maybe I'm going hiking, got a hot date, I'll take a double dose of Super Greens and Essential Source to make sure my body is getting the nutrients that it needs. So if you're not willing to do anything else, please at least get the Super Greens, the Essential Source. Those are on my website, drjoe.com, also available on Amazon. But you got to get the liver working properly in order to work. I'm going to start taking some callers, so let's see if I can do this here. Kevin, how can we make your day better? Hey there. Okay. Yes. Sure. Easy. Actually, number one question I get is how do I lose weight? Number two is how do I gain weight? So you're not alone. I have two of my staff members that are on the same boat that you are. Nuts and nut butters are awesome for that. Cashew butter, almond butter. Stay away from peanut butter. Peanut butter has a mycotoxin in it that can cause allergic reactions. It's high in omega-6 fatty acids that can cause inflammation. So cashew butter, almond butter, there's filbert butter. My favorites are cashew and almond butter. But I want you to start adding that to a lot of your meals and then adding nuts to your meals as well. Cashews, almonds, pecans, pistachios. And that's one of the quickest, easiest ways to start gaining weight. Avocados are very good for that too. You know, 1 or 2 a day is good. If you do 2 or 3 a day, now that'll help start gaining weight too. And let me ask you a question, Kevin. You having digestive problems, acid reflux, heartburn, burping, gas, bloating? Okay, good. So you're absorbing your nutrients then. And then take Dr. Joe's Super Greens and Dr. Joe's Essential Source as well, because that's going to give you the nutrients that you need for your body to normalize the metabolism. But try eating more nuts and avocados and let's see what happens. Thanks, man. Appreciate it. Okay, good. And folks, I'm Dr. Joe Esposito, if you're just tuning in. My website is drjoe.com. Hundreds of hours of archive radio shows there. If you have a question, the lines are open right now, 844-44-Dr. Joe, 844-44-DRJOE. And that number, by the way, rings through to my offices in the Atlanta area, offices in Marietta, Duluth, and Stockbridge. And we can, if you want to make an appointment, if you have questions, if you can't get on the air today, that's fine. You can always call the office, 844-44-Dr. Joe. Folks, I got to run real quick. We talked about Dr. Joe's Super Greens and Dr. Joe's Essential Source. There's a lot of other supplements I'm going to recommend too. I'm going to talk about vitamin K2 and statin drugs. I'm going to talk adrenal support and statin drugs, B complex and statin drugs. I'm Dr. Joe. Don't go anywhere. We're going to be right back.
Did you know that
There we go. All right, now hold on a second, folks. I gotta see.
That's redone over
Well, the mouse is definitely disappeared.
I can unplug and get you this one.
Actually, I can work it. I'll be fine. Okay, I just got to check the times out when I'm out here. 27, 48, and 57. Okay, good. All right. So anyway, another question. I'm sorry about that. Real life radio, folks. This is what happens in real life.
Okay, so Miss Jamie Hill.
Hi, Jamie Hill.
Her 5th lumbar is flat.
Yes.
And SI joint is fused together.
Yes.
Sometimes the 5th lumbar slips behind the SI joint, causing me extreme pain. Is there a non-surgical solution?
Yes, I have a very similar condition. My 5th lumbar is broken and it slides forward. It's called spondylolisthesis. What you have is your sacrum and ilium are fusing, and that could be a genetic predisposition to have that. And the answer is yes, because I have a condition like yours, and when we adjust the spine, putting the bones back in place, in many cases, does tremendous. The big concern I have, like I have myself, is that those nerves control the colon, sex organs, and bladder. So now you might see things like gas, bloating, diarrhea, constipation, urinary problems, period problems, sexual problems. Everything from the waist down is being affected by that 5th lumbar and the sacrum. The sacroiliac joint also has something in it called proprioceptive fibers. They tell you where you are in space. So many times when I see people with sacroiliac injuries, they are a little off balance. They're not as coordinated. So people might say you're clumsy. It's not that you're clumsy. You're affecting the proprioceptive fibers by having those bones out of place. So it'd be a good idea to come see us and let's get those bones put back in place.
Might be my girlfriend's problem.
Oh, yeah? Okay. I'll get her fixed too then.
No,
Well, she's starting to get.
She's clumsy.
Oh, she's clumsy. Well, check the sacroiliac joint and the TMJ as well. The jaw also controls proprioceptive fibers.
All right. Do you have any advice for hyperthyroidism?
Hyperthyroidism is the precursor to hypothyroidism. So my big concern is that you might burn out your thyroid and eventually go to hypothyroidism. So with hyperthyroidism, yes, absolutely. This is one of the few times I'm going to tell you to stay away from cruciferous vegetables like broccoli, mustard greens, because cruciferous vegetables have something called a goiterogenic chemical in it that can block up your thyroid. Second thing is we got to check the nerve supply in the neck that goes to the thyroid. Third thing is we have to look at your food intake. Oh, that's me, isn't it? Okay. Can lower that. Sorry about that. You want to avoid chlorine, fluorine, and bromine. So fluorinated toothpaste, absolutely out. I would get a water filter for your whole house to filter out the chlorine and the fluorine. I would stay away from processed breads because they have bromine as a dough conditioner. So chlorine, fluorine, and bromine can block up your thyroid gland and you're not absorbing iodine. The other thing we might want to do is get you on an iodine supplement like Dr. Joe's Super Greens and Dr. Joe's Essential Source they have sea vegetables, and sea vegetables have iodine, great source of iodine. So super greens an essential source. Bromine, chlorine, and fluorine, stay away from it. Get the nerve supply checked, and then we can also get you on a thyroid supplement. And if you call my office, 844-44 Dr. Joe during the week, we can get you on a thyroid protocol of supplements as well. Next question.
How do you clean out your liver?
The cool part about the liver is this, and that's a great question. I got to say it to my on-air people too. The liver is the fastest healing organ in the body. So as soon as you stop putting the junk in, the liver starts to heal. So that is an excellent question. And Garrett, remind me when I go back on the audit, answer that question, because I wasn't clear on that. We got to talk to people how to do it. So Super Green's an essential source. Dr. Joe's nitric oxide support, that's on the website, drjoe.com. And then if we need to, if it's really bad, we get you on things like milk thistle, which can also help heal the liver. But once you stop putting the junk in, alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener, start eating more fruits, vegetables, nuts, and seeds, the liver starts to heal that day. Next question.
Next question. Degenerate lumbar support.
Degenerate lumbar support.
Degenerative lumbar.
Degenerative lumbar condition, do you need to support it? The reason joints wear out is because they're out of alignment. They rub up against each other. Okay, that's called osteoarthritis. So if you have osteoarthritis, the bones are out of place. So step number one has to be, put the bones back in place. And that's where we come in as chiropractors. If you don't put the bones back in place, I can get you in $400 back braces that'll work great and support you till the cows come home. The problem with back supports is once you start using them, if you use them for long periods of time, the muscles become weaker and weaker. So I would suggest chiropractic care first. If we still need stabilization, then a support. But you want to get to the cause of the problem, not just treat the symptoms. So give us a call, 844-44 Dr. Joe. We'll get you set up for appointment.
I'm going to try this one out. Diverticular disease.
Diverticular disease.
Diverticular.
Very good.
See, and I thought there was supposed to be a T in
There's
there.
a T in there, yes. Diverticular disease. Your colon is a tube. And if you ever had a bicycle and it got a bubble in it, or a tire that got a bubble in it, those are called diverticulum. And that happens many times because you don't have enough fiber in your diet. And the bowels become constipated and pressure builds up and it causes that little bubble to form called the diverticulum. And so what we need to do is increase your fiber. So I would take Dr. Joe's intestinal cleanser. That's on the website, drjoe.com. Take one, see how you do the next day. If your bowels are moving 2 to 3 times a day, great. Next day, take 2. If they're not, if the bowels are moving 2 to 3 times a day, stick with 2. You got to find out what level is best for you. And then you can go to 3. I wouldn't recommend taking more than 3. You may need to take 3 for a few days to get the bowels moving. You got to get to a plant-based diet. You got to cut out the things that have no fiber, which are meats and dairy products, animal proteins, because they have no fiber in them at all. So more fruits, more vegetables, Super Greens, essential source, Dr. Joe's intestinal cleanser. You might even want to take Dr. Joe's nitric oxide support. That's going to increase the circulation and help the healing process. So that's the approach I would take, and you have to adjust the low back. The nerves in the low back control the colon. So if you're having problems in the low back, you got to get that fixed as well. So, call us and we'll get that fixed.
Lastly,
Yes.
You mentioned a water filter. I know we talked about it last weekend as well.
Yes.
Maybe not the brand of water filter, but what type of water filter?
It depends how big you want to go. I say go big or go home. Okay. I used to date a girl, and her great line was, moderation is for monks. I want extreme life. And that's how I feel about health. I want extreme health. So I have a whole house water filter. You can get them from anywhere from $600 to $1,200, $1,300. You can go to the big box stores and get them if you need to. And you want to filter out everything in your house, because when you take a shower, I keep looking to Ahmad, by the way, when I got to go back on the air. If you take a shower, if you take a hot shower, you're absorbing about the same chlorine as 8 glasses of water if you don't have a filter. So that's why I recommend spending the money and going big time and getting a whole house water filter. So go to big box stores and they can help you out there if you need to. 40? 30 seconds. Here we go.
Language are, maybe it will go away. Stop suffering and start
Keep watching,
getting
folks.
well.
I'll be back.
Dr. Joe Esposito is on WSB.
5, 4, 3, 2, 1. Hey, folks, Dr. Joe here. So glad we could spend a little time together here. It was when we were at the break, somebody asked a question. They said the question, how do you clean out your liver? Because we're talking about statin drugs, pesticides, your cell phone, and your heart. And I talked about how if you clean out the liver, many times your cholesterol levels normalize. And one study I read showed that 99 out of 100 people can get good results by changing their diet. And the question was, how do you clean out your liver? That's a great question. The liver is the fastest healing organ in the body. So the nice part is when you stop putting the junk in, it starts to heal. So cutting out the fried foods, the processed fats, cutting out really most fats is going to do tremendous, but you also got to cut out the sugar. Because if you put sugar in your liver, fructose has to be converted into glucose. And if you do more than about 30 grams of fructose a day, it builds up something called uric acid and then can start to form fatty liver. Now, uric acid gets in your joints and it hurts. Now, I'm a chiropractor. What's my job? What's my team of doctors? Our job is to get you out of pain and get your nervous system working well. And if you're taking if you're taking fructose in your body, you're building up uric acid. Uric acid prevents nitric oxide production. And that's why Dr. Joe's nitric oxide support is such an amazingly popular supplement, because people don't have good nitric oxide many times because of sugar, and they take the nitric oxide and they start to feel circulation coming back into their body all over their brain, their reproductive organs. So as men and women get older, things may not work like they used to. The nitric oxide showing a lot of promise in that area, and people just love it. And that can increase circulation to the liver and help get that healed up as well. But stop putting the junk in, what I call the 7 deadly sins: alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. Start putting the good foods in: fruits, vegetables, nuts, and seeds, Dr. Joe's Super Greens, Dr. Joe's Essential Source. Please, folks, if you're not going to do anything else, at least take Super Greens and Essential Source. I mix it with coconut milks. I like the flavor. Or almond milk, shake it up and drink it at least once a day. Very inexpensive, just over $2 a day. And you're getting unbelievable. What you're getting is like off the chart for $2. It's crazy. So, and that's when the liver starts to heal. Okay. Now, again, if you're under medication, stick with your medication, follow your doctor's orders, and then have the doctor monitor you. Let's do my liver enzymes. Let's do my cholesterol. And let's see how we're doing 2 months, 6 months down the road. Usually it's even faster than that. And they go back, and I hear this almost every day in my office. The medical doctors say, whatever you're doing, just keep doing it. Because whatever you're doing is working. The blood pressure is changing, the liver enzymes are changing, cholesterol is changing. And a lot of times I say, well, I'm doing what Dr. Joe says. And I love this. Many times doctors will say, listen, if Dr. Joe says it, just do it. He's the guy. He's the man. I love that. So, and also losing weight is going to help too. In our office, we have a doctor-supervised weight loss program. And it's a cleanse more than a weight loss program. But one of the side effects is you lose a ton of weight. And so the Dr. Joe's cleanse is spectacular. And if you call my office, we could give you more information about that. But the cleanse is great. It's a 21-day cleanse, and I ask you, listen, just do what it says for 21 days. Eat right, basically eat the way I tell you to. And it's a series of supplements that you take and fiber to clean out the colon. And many people report 10, 15-pound weight loss. And I tell them, listen, I'm not here to help you lose weight. I'm here to clean your body out so that you do lose weight. And I know it's semantics, but it works real well. So we supervise it with you. So if you want more information, you can call my office at 844-44-Dr. Joe. So we're talking today about statin drugs, pesticides, cell phones, and your heart. I got a lot of callers here, so let me start taking some callers at 844-44-Dr. Joe. Tony, help me make your day better. You're welcome. Right. Sure. Okay, so you want to know about wheat and grains, and are they good or bad? And the answer is you want to stay away from grains the best you can. Now, in a real world, that's pretty hard to do, and I'm also a realist. I get that. Wheat especially, wheat has a protein in it called gluten, and gluten has 2 components called gliadin and glutenin. And if it gets into the body and the immune system recognizes it as a foreign protein, it can attack it. Wheat and grains are still sugar. Bottom line is they break down into sugar, and we want to have less sugar in our body, not more. A lot of the modern wheat now is sprayed with something called glyphosate, which is the pesticide, which we're going to hopefully cover today. And the pesticides, when they get into the body, can disrupt the bacteria in your colon. And glyphosate, it gets a little complicated here, is glycine, which is an amino acid. And so it replaces good amino acids with the glyphosate, and then the protein doesn't work properly. So it can affect your digestion, it can affect your body's ability to break down proteins. So I'm not a big fan of wheat. Of all the grains, I'd say try to avoid the wheat the best you can. If you're going to do a grain, something like quinoa is probably a better choice. Rice is still a sugar. Rice can have chemicals in it as well. arsenic, for example. So quinoa is probably going to be the better one. Amaranth, spelt is still is wheat though, so you want to stay away from that one. So the answer is try to stay away from grains if you can. Okay, my pleasure. Oh, we got another caller. Is that caller? I guess the caller is there. I can't see what. And the caller's not there. Well, then never mind. So, folks, if you have a healthcare question, give us a call, 844-44-Dr. Joe, 844-44-DRJOE. That number rings through to my offices when I'm not on the air. All right. So we're talking today about statin drugs, pesticides, and your cell phone. Statin drugs may decrease the frequency of mild heart attacks, but they don't necessarily lower your risk of heart disease or death from major heart attacks because they themselves can damage the muscles, including your heart muscle. So minor heart attacks, yes, studies seem to show they help, but major heart attacks and actual overall death, not a big change there. And a side note, statins' ability to lower risk of minor heart attacks is probably related to our ability to lower something called a C-reactive protein. C-reactive protein determines how much inflammation there is in your body. So it helps reduce inflammation, but there's a cost of that. And this Dr. Graveline, who we're talking about today, he said you only need about 1/10 of the dose of a statin drug to help reduce the inflammation in the body. And so we're taking a lot more than that. So once again, be careful not to lower your cholesterol too low. That can become a problem. So you're kind of trading a heart attack for heart failure. And I think a heart attack is preferred to heart failure. So you're lowering the risk of having a heart attack, but a heart actually stopping, not so much change there. So statins lower your cholesterol, but that's an important precursor to your steroid hormones like progesterone, testosterone, aldosterone, cortisol, vitamin D. Cholesterol sulfate, this is produced when you expose your to your skin, you expose your skin to the sun, enters the cell membranes and helps build structured walls that protect oxidative damage. So you need that cholesterol to create your cell walls. Your cells are made of something called the lipoprotein layer. Lipo is fat, cholesterol, and protein is protein. So you want to make sure you're getting good proteins into the body and good fats into the body so you can build these cell walls. And that's where nutrients pass into the cell and waste products pass out of the cell. So if you lower your cholesterol too much, that can become a problem. And cholesterol is necessary to create something called DHEA. And pregnenolone becomes DHEA. DHEA becomes your sex hormones, testosterone, estrogen, progesterone. If you're under stress, DHEA then becomes cortisol, which is your stress hormone. And we can measure at our office, we can do a test for your cortisol levels, by the way. If you want to get a test, you can call my office, DRJOE, 844-44-Dr. Joe. And we can talk about doing a stress level, your cortisol level, and then we can determine if your adrenal glands are pooping out. And then we can get you on some of Dr. Joe's adrenal support, which I take every day, by the way. Dr. Joe's adrenal support is great for getting your adrenals, for inflammation, for your sex hormones, and for energy. And so I take Dr. Joe's adrenal support every day. If you do coffee, if you're under a lot of stress, if you're probably over 40, bags under your eyes, these are usual signs that the Dr. Joe's adrenal support are probably something for you. Folks, got to go to break. If you have a healthcare question, give us a call, 844-44-Dr. Joe. My website, if you want to order supplements, my books are there. Hundreds of hours of archive shows, drjoe.com. Supplements are also available on Amazon. drjoe.com is an easy way to get them. Hey, don't go anywhere. We're going to be right back. All right. That's live radio, folks. Got to take my super greens and essential source now. While Garrett reads me my next question.
Next and only question, if y'all don't start getting some
If you're watching, folks, give us a call. Send us your questions.
Are there safer alternatives to estradiol patches and progesterone prescriptions?
2 weeks ago, we did a show strictly on hormones. And again, I'm not here to take you off your medication. I'm not a medical doctor. I can't tell you to do that. But if you go to my website, and I think it was 2 weeks ago or 3 weeks ago, we did a 2-hour show on hormones and how to balance out the hormones. So I'd recommend you listen to that whole show because it's too much information to give you in just this little 1-minute segment between breaks here. But yes, the answer is yes. And so you can do certain things like, for example, your adrenal glands, Dr. Joe's adrenal support. Your ovaries produce your female hormones and your testicles produce the male hormones, but your adrenal glands produce male and female hormones. And so even when you're older and you're not having a period anymore, men you're getting older, your testosterone levels are dropping, the adrenal glands are still producing all your sex hormones. So that's one of the reasons at my age I take Dr. Joe's adrenal support, super greens and essential source, I take nitric oxide, I take B vitamins, and in the winter I take vitamin D2, which we're going to talk about in a little bit as well. So those are on the website, drjoe.com. So Super Greens, essential source, and adrenal support minimum for someone like you, and then listen to the whole show. What else?
Would that be the women's health issues?
Yes.
Perfect. I'm going to share this to her. No other questions, but
Okay.
here we go. Is taking a zinc supplement effective against catching a cold?
Yes. Zinc actually binds to the rhinovirus and prevents it from replicating. So the answer is yes. And you can do it from food, like nuts are high in zinc, or you can take an actually zinc supplement. If you take too much zinc, it's going to dry you out. You're going to get cotton mouth. So be careful with that, but make sure you follow the recommended dose. You don't want to overdose on zinc. But I have Dr. Joe's seasonal tonic, which is, if you have a cold, it's ginger, horseradish, cayenne pepper, onion, and garlic, and we puree that in apple cider vinegar. It tastes awful. It tastes like a really bad salad, well, good salad dressing, actually. But I take that if I do feel like I'm getting sick. I take Dr. Joe's Wellness Booster every day throughout the winter, because the Wellness Booster has echinacea, pau d'arco, olive leaf extract, and that helps keep the white blood cell count active in my body. And last season, when everybody was sick with the flu and everybody was going nuts, not even a sniffle. So it's really, stay away from the sugar. Super Greens, an essential source, Wellness Booster, and seasonal tonic, and then the vitamin D, which we're going to talk about. Vitamin D is absolutely positively necessary to keep your immune system strong.
Here's one I've wanted an answer to. How many supplements do you take in a day?
I take Super Greens, an essential source. I take Dr. Joe's B complex once a day. I take Dr. Joe's adrenal support once a day. In the winter, I take K2. I'll take nitric oxide once a day. And then depending on other circumstances, like I'll take, if I eat a cooked meal, Dr. Joe's enzyme support, because you need enzymes to help break down your nutrients. I don't do any antibiotics, but a probiotic is spectacular. We have Dr. Joe's probiotics, which is just off the chart as far as effective. And you can take that as well. But personally, and then I take an omega-3 as well, which is not a Dr. Joe product, but will be soon. I'm finding a manufacturer I can trust to meet the standards that I require. But I take an omega-3, an algae oil, and I take a gram of that a day. So the only one I take that isn't a Dr. Joe product is the algae oil. I'll keep looking over to Maude, by the way. He's
How much exercise and what kind do you suggest?
It depends what you like. The thing with exercise is you have to find something you like. I love kayaking. I love hiking. I don't like going to the gym. I get bored. And so I can sit there and do my weights and everything's great. That's wonderful. Minimum would be 10,000 steps a day. So get a pedometer, don't use your phone, because we'll talk about how dangerous the phone is in just a second when it's close to your body. But get a pedometer, you want to walk about 10,000 steps a day. That's the equivalent to a 20-minute aerobic workout. So you got to find out what you like. My friend Tim, for example, loves mountain biking. I don't like mountain biking, so he goes out and he mountain bikes, and that's great. And, you know, yesterday, okay, he went mountain biking, and afterwards we met, we had some dinner, and we had a great time. So find out what exercise you like, but a minimum of 20 minutes a day of doing something very active, or 10,000 steps a day. And then depending what you want to do, if you like weights, you can do weights. I got to go back on the air, folks. So keep the questions coming and tell your friends, and I got to go back on the air.
75 over to exit 53 Moreland Avenue, blocking 2 left lanes along the way, and that's causing heavy delays back to Loop Road at the airport. And still seeing a bit of slowdown 85 southbound from exit 120 Hamilton Mill down to the Mall of Georgia. Jill Nelson, WSB.
Personal responsibility and independence are important to you. Start today with something completely in your control, your health. Dr. Joe Esposito is on.
Hey folks, Dr. Joe here. So glad we could spend a little time together. Thanks for being here. And we're talking today about statin drugs, pesticides, cell phones, and your heart. I know it's an odd combination. We're going to cover them all there, I promise you. Really good information here. But when I was researching all this, it just blew my mind. And I said, I got to do a whole show on this. This is just like off the chart cool. So let's see here. Cleans out fat from the liver. Okay, lecithin, they said, also cleans out the fat from the liver. Screener, somebody called in. Yeah, but I'm not a big fan of soy. So if you're going to do soy lecithin, I'm not a big fan of soy lecithin. But you're right, lecithin can help clean out fat from the liver as well. So, see, I love you guys being interactive. If you have a question, give us a call, 844-44-Dr. Joe. The same enzyme that produces cholesterol in your liver produces something called coenzyme Q10 or CoQ10. And that's needed for muscle health. It also lowers your levels of vitamin K2 and something called HMG coenzyme A reductase. And the other, the latter one, the HMG, is an enzyme in your liver that helps make ketones. And you need ketones as part of your fuel process as well. So if you're taking a statin drug, I strongly advise, excuse me, that you take CoQ10 as a supplement. Because the same enzyme that, again, produces cholesterol produces CoQ10. If you don't have enough CoQ10, CoQ10 gets into the cells and makes the mitochondria work. Now, the mitochondria is the powerhouse of your cell. It makes electricity, so to speak. And if the mitochondria are not working properly because you're not giving enough CoQ10, you get tired. And a lot of people on statin drugs report that they're tired a lot. I understand that because of the CoQ10 issue. Taking the CoQ10 is important. Years ago, I was doing a show, and a friend of mine called me up after the show, and he said his girlfriend at the time, maybe still his girlfriend, I don't know, is a pharmacist. And she was listening to the show, and she said she had never heard this. So I sent her some of the research that I had, and he called me back a couple of days later, and he said, she cannot thank you enough. She was blown away. She had never heard about this CoQ10 connection with statin drugs. And now she said, whenever somebody gets statin drugs at her pharmacy, she sends them right over to the supplement area and says, get some CoQ10 as well. And she said the results have just been off the chart. People are feeling better. They have more energy. Thank you so much. I was tired all the time. Your heart is a muscle, and your heart has mitochondria in it. And the mitochondria have to generate electricity to make the heart beat. So it's really important that if you're taking statin drugs, you consider taking the CoQ10 as well. Statins lower some other things, like dolichol. Okay, Dr. Graveline believed it's important as CoQ10. Not only does dolichol play an important role in mitochondrial function, but it's responsible for the process of putting sugar chains on top of glycosylated proteins. And it's important because these glycoaminoglycans help maintain the barrier in the cell and regulate uptake of nutrients. So once again, this helps the cell wall absorb nutrients and pass out waste products. So this is another problem. See, there's the up and the downside to taking these medications. And again, I'm not against the medications. I'd rather get you healthy so you don't have to take the medications. Well, I shouldn't say I'm not against the medications. I don't have the right to take you off the medications. Okay? In practical terms, it means your muscles, including your heart, which require a lot of energy, are heavily impacted by the statin drugs. One side effect of the dolichol is type 2 diabetes. Statins have been indeed have been found to cause drug-induced diabetes. Wow. So if you're taking statin drugs, it may be the reason why you're now suddenly diabetic. And if you're not getting a CoQ10, the DNA can't repair itself like it's supposed to. And then we have altered cells not doing 100% of their job. So if we can just get the body healthy, we might be able to get you off some of these meds. Folks, if you have a healthcare question, 844-44 Dr. Joe. Somebody was just on there and they hung up. So folks, hang on. I'm going to get to you, I promise, if you call 844-44 Dr. Joe. That number rings through to my offices when I'm not on the air. Because a lot of patients would a lot of you would like to become patients. We'd love to have you as a patient. In the Atlanta area, we have offices in Marietta, Duluth, and Stockbridge. So go to my website, drjoe.com, or call 844-44 Dr. Joe, and we will get you set up as a patient. And we want to get you well. We want to get your nervous system working, your digestive system working, and good nutrition. Those are the things. And I know we're coming close to a break again here. When we come back, we're going to talk about cell phones and how it affects your heart. And then we have to talk about what? Digestion. If you've listened to my shows before, we have to talk about digestion, I think, in every single show I've ever done because it's so important. So many people have acid reflux and heartburn and burping and gas and bloating. And many times that's because the stomach is pushing up against the diaphragm. And we need to manually massage or pull the stomach down away from the diaphragm and then get you on a diet that helps to increase your stomach acid, not decrease your stomach acid. So many people think, well, I have acid reflux, I got to produce less acid. No, you need more acid, not less acid. Because many times the food will sit in your stomach if you don't have enough acid, and it essentially rots. And it gives off lactic acid. So coming up into your esophagus may not just be stomach acid, it might be lactic acid from the rotten food. And that can be causing some real serious problems. So increasing the stomach acid and massaging or pulling or adjusting the stomach away from the diaphragm many times helps solve that problem. And your stomach's job is to take proteins and break them into amino acids. Then it goes into the small intestine where the amino acids get absorbed and they get utilized for liver and heart and blood, and every cell in your body has some amino acids in it. So if you're not breaking down your amino acids properly because your stomach isn't working properly, it's going to affect the function of every cell in the body. And then these big chunks of protein, if they do get into the small intestine, can cause an inflammatory reaction, which can essentially tear little holes in your intestine, causing leaky gut syndrome. And you get little holes in the intestine where these big chunks of undigested food can be absorbed. And now the immune system starts attacking them. In fact, one of the things I was talking about when I was visiting a doctor friend of mine to his staff is one of the guy's wives has an autoimmune condition. And I talked about if we can heal the gut, many times that solves the problem and the immune system starts to heal. And he looked at me, and he said, I've never heard that before. And then he said the words I love people to say to me, that makes sense. Most people have digestive problems when they have immune conditions. Most people have digestive problems if their brain isn't working properly because you're not absorbing the amino acids. And if you're taking the proton pump inhibitors or the medication to help the stomach acid, there's proton pump inhibitors and there's H2 blockers. And both of them lower your body's ability to produce acid, which prevents your body from digesting food properly. And if you do take them, many times you're not absorbing calcium, B12, iron, and magnesium, so your body goes into nutritional deficiencies. That's why things like Dr. Joe's Super Greens and Dr. Joe's Essential Source, people report amazing results because so many people are deficient in nutrients, and just getting the minimum amount of nutrients makes dramatic changes. So if you want the Super Greens, the Essential Source, they're 2 powders. Get them on my website, drjoe.com. Also available on Amazon too. Hey folks, if you have a healthcare question, 844-44-Dr. Joe. My website is drjoe.com. If you have questions there, you can listen to archive radio shows, make an appointment. We'd love to see you. Folks, I'm Dr. Joe Esposito. Don't go anywhere. We're going to be right back.
Train Company thanks you for your business.
Got a lot of them now.
My family's.
Well, that always happens. We get no questions for the first hour of the show, or a few, and now the phones are lighting up too. Cell phones and stem cells, 2 different questions. Just got prescribed statins. Okay. Okay, go ahead.
Okay, so 2 people have actually asked this question. CoQ10s.
Yes, CoQ10, yes.
Yeah, or CoQ10.
Coenzyme Q10, correct.
Is there a vegan alternative that you would still suggest to maintain?
Well, I'm hoping that if you're vegan, you may not be needing the statin drugs, and your body is producing CoQ10. So there's the dilemma I have on that one. So
Maybe they're cheating.
Well, don't cheat then. There you go. Go on Dr. Joe's Cleanse. We talked about the weight loss support, the supervised weight loss support. It's really a cleanse, and if you do that, many patients report that their blood levels change dramatically. If you call my office, 844-44-Dr. Joe, you can ask for Kayla, actually, Kayla or Tara, but probably Kayla, and they'll get you the information on the cleanse. It's pretty amazing for 21 days. Yeah.
So this woman has an abnormal growth in her breast.
Yes.
They've confirmed that it's not cancer.
Good.
And they've suggested that, or they've offered that she could either have it removed or monitor it for 6 months.
Right. What would I do?
What would you do?
Monitor it for 6 months. Go on a plant-based diet. Take Dr. Joe's Super Greens, Dr. Joe's Essential Source. I'd also recommend Dr. Joe's Enzyme Support. Want to get those enzymes in there to break these things up. And then also, if you're not getting out in the sun, vitamin D2. D3, I'm sorry, and that's on the website too, D3 with K2. And do that for 6 months, go back and see what happens. But if you go to a plant-based diet, and if you don't know what to eat, on my website, it's a great book. It's called Eating Right for the Health of It. It's one of the first books I wrote. And it tells you how to change your diet. On the website, if you go to my YouTube channel, we have the 7 Deadly Sins of Nutrition video, So What Can I Eat, which is an audio, but it's on YouTube as well. And once you change your diet and start making these changes, go back in 6 months and then call me back and tell me how cool it was.
All right, what causes low white blood count?
Could be a bone marrow issue. Okay, so then we have to start figuring out why the white blood cells are so low, and many times we straighten up the liver and get the body alkaline. So what you can do is get some pH paper, you get that at a drugstore, pee on it first thing in the morning, pee a little bit to clean out your urethra, wave it under there, and it's going to be a color chart. And you want to look at the color chart, you want to be about 6.5 to 7.0. And if you alkalize your system, that should help tremendously. And that's what I would suggest. Go with Jennifer here.
Yes, supplements for lowering blood pressure.
Nitric oxide works really well, but if you have acid reflux, if the stomach is pushed up against the diaphragm, the same nerve that controls the stomach controls the heart. It's called the vagus nerve. And many times you pull the stomach away from the diaphragm and stimulate the parasympathetic nervous system, the blood pressure drops. So Nitric oxide should work well, but be careful if you're on medication, monitor your blood pressure. I don't want it going too low. And yes, we're going to have to, ready? Yeah, okay. So hold your questions, folks. I got to record some what's called liners for my stations around the country. We are all around the country, all around the world. So these other stations, I have to do these liners for them. So, okay. I'm Dr. Joe Esposito. This week, we're talking about statin drugs, pesticides, your cell phone, and how it affects your heart. Dr. Joe Esposito here. This week on my show, we're going to be talking about statin drugs, pesticides, your cell phone, and how those things can be adversely affecting your heart, and then what to do about it. Okay, we're talking about statin drugs, pesticides, and your cell phone, and how it affects your heart, and then what you can do about it. This week on the Dr. Joe Esposito Show. One take. Professional. All right, go ahead.
Best thing for sore joints.
Chiropractic care is absolutely positively the number one thing you need to do. There's no question about that. Chiropractic care is going to put the bones back in place and help the joints. Then the Super Greasy Essential Source is going to alkalize your system, so I'd recommend that. The nitric oxide can increase circulation for that, and that may help as well. And then changing your diet, getting off the wheat and the dairy especially, those are the two things that cause the inflammatory reaction in the body. And that should solve the problem.
Weekend for the Braves as they lose again to the Rockies.
Alternative for Risperdal. Alternative to Risperdal for dementia.
Okay, that's a whole lecture. Okay, on my website, I know I've done shows on that. So if you go to my website, drjoe.com, you got to give up the sugar. Sugar binds to proteins, and that can cause a lot of dementia issues. We're finding now that hardening of the arteries and circulation is directly linked to dementia. So Dr. Joe's nitric oxide is a good idea, but you got to clean out the arteries. And you clean out the arteries by staying away from the 7 deadly sins: alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener, eating more fruits, vegetables, nuts, and seeds, going to a plant-based diet. Now, the difference is vegetarian diet is you can be eating brownies and cookies and cakes. It's vegetarian. Plant-based is you want to get it as close to the whole food as possible, as close to the plant as possible without being processed. So a plant-based diet is going to do tremendous work for that. And Super Greens, an essential source, of course, is the core of everything. And then if you're overweight, we can put you on the doctor-supervised weight loss program that we have to kind of jumpstart the weight loss. Because I find after 21 days, and people have they start to lose the weight in 21 days, they're motivated, and then they stick with what I'm telling them a lot better. So that's why I like the doctor supervised weight loss program. And that's on the web. You can go to our website, drjoe.com, or just call us at 844-44-DR-JOE during the week when I'm not on the air, and hopefully we can get that set up for you. All right, we got about a minute, 2.5 minutes.
All right, this person has high liver enzymes.
Yes.
What should they do?
Okay, well, that's what we've been talking about today, is let the liver start to heal. The enzymes are high because the liver is being overworked. So if you go to once again, it's not like a broken record, a plant-based diet, Super Greens, an essential source, staying away from alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener, you give it 3 months or so, 2 months, and then go back and check it again. In most cases, the enzymes drop. You can also do the nitric oxide to support the increased circulation to the liver to flush out the waste products. And again, follow your doctor's advice, make sure he's monitoring you along the way. But if we can get it better, doctors love that because they say, hey, I'm taking you off the medication. Then they score. They look like they're heroes, and they are heroes because they work with you to help get you well. Yes.
What's your favorite meal?
Beef goulash with egg noodles. Haven't had it in 35 years. But you asked what's my favorite meal.
What is your favorite vegan?
I love Ethiopian food. If you want to take me out to dinner, I would say let's go for Ethiopian. I love Ethiopian food, and they got a huge vegan choices. So if I had to pick and I'm Italian, so I'll tell Grandma Esposito in heaven, she'll get very upset. But I love Ethiopian food; is my favorite. So that's it. And Super Greens is an essential source, of course.
Here's one you can answer quick: is tofu good for you?
No. If you're going to do tofu, it's got to be organic and in small amounts. All right, folks, keep the questions coming. As you know, follow me on Facebook. Hey, you know what? Send me your email address to my website, and we'll put you on our newsletter too. Because we send a lot of good information on newsletter. We'll never give out your email address. Don't worry. but a lot of good specials sometimes on supplements. We'll get you there if you send me your email address.
Joe Nelson, WSB.
I'm Channel 2 Action News Meteorologist
All right,
Brad
hold on,
Pitts with
folks.
Atlanta's most accurate and dependable weather forecast.
Again, if you want to hear the questions, go to WSBradio.com or 750 AM, 95.5 FM in Atlanta.
This evening. Overnight and into Monday morning, mostly cloudy down to 72, and then we'll have some scattered showers.
Lots having fun over there.
Increasing as we head into the afternoon tomorrow. Rain chance at 60% and a high of 85.
I get to know the weather in
On
Atlanta.
Tuesday, mostly cloudy, low 72, high 86, 60% chance of rain, but we'll be dry by Wednesday, partly cloudy with a high of 85.
WSB Storm Tracker radar showing some showers in Atlanta, Marietta, Smyrna, and in Douglasville right now. 78 degrees on Peachtree Street at News 95.5 and AM 750 WSB.
Here we go.
Depends on it.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Hey folks, Dr. Joe here. So glad we could spend a little time together. Interesting show today, and a lot of great questions, by the way. I appreciate your great questions. Sending me through Facebook and Instagram if you want to send questions. Follow me on Facebook, follow me on Instagram, and also do this. Sign up for my newsletter. Just go to my website, drjoe.com, and it says, comments or questions. Send me your email address, and I'll never give it out. Don't worry. But the reason I do that is a lot of times we have specials. I'll have lectures coming up where maybe the sponsor is selling tickets, and I always insist that they give me free tickets so I can give them to you guys. Sometimes supplements. We'll have specials on supplements. We'll have special private breakout sessions just for people on our newsletter list. So send us your email address at drjoe.com. You get all sorts of cool stuff, and it's a lot of free stuff too. So we're talking today about statin drugs, pesticides, wireless cell phones, and how it affects your heart. And we talked about the medications, and I got one more question there for Ron, so keep hanging on there, Ron. And then going into cell phones and how cell phone radiation, how it actually affects your heart. It opens up your calcium channels and dumps calcium into your cells, which can cause the cells to malfunction. This is new research that's out. It's really cutting edge stuff. It's really cool. If you have a healthcare question, 844-44 Dr. Joe. Let's start taking some calls. They've been holding for a while now. Ron, how can we make your day better? Well, thank you for your kind words, Ron. Yes. Right. Sure. 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 Right. Okay, so the question is, Ron, you have diabetes already, you just prescribed a statin drug, and you're worried about that, and I don't blame you. You should be worried about that. So what we want to do then is, if you do start taking the statin drug, again, I prefer you just get healthy, and hopefully you won't need the statin drug. And it's neat because the same thing that would help the cholesterol also is probably going to help your diabetes. So if you get real, that's quite right. Yes. Correct. Yes. Yeah. So how do you get rid of how do you clean up the liver? Milk thistle is something that's very good. It has something called silmarian in it. And silmarian has been shown to help clean up the liver. Cutting out the processed foods, the breads, cookies, cakes, donuts, pastas, meat, sugar, dairy, fried foods. You really want to go to a more plant-based diet. Like people say, what do you eat, Dr. Joe? start out my day every day with Super Greens and Essential Source, absolutely positively. And then if I'm going to do a radio show or something else, I'll take a second dose of Super Greens and Essential Source. Then I'll have maybe some fruit, maybe a little oatmeal. So I just take, you know, organic rolled oats, and I'll add some coconut milk to it and some raisins, and I don't even cook it. Snack is usually a handful or two of nuts. Lunch almost always is a big salad, and I add nutritional yeast to it. I may add some sunflower seeds to it, maybe chickpeas if I want to get really crazy. Woo, it's party time. And then in my book, Eating Right, I know I'm a crazy guy. I don't know how I live this fast-paced life. And in my book, Eating Right for the Health of It, I get my books confused here, really tells you how to change your diet. Breakfast, lunches, dinners, snacks, bunch of recipes. And then dinner kind of varies. I'll go out with my friends and maybe we'll go to, get some Asian food. I love somebody asked me what's my favorite meal. I love Ethiopian food. And I know I'm Italian. My grandparents are passed, so I can say this now without them getting mad at me. But I don't go to Italian restaurants. I make much better food than any restaurant can make. But I love Ethiopian food. But a salad, stir-fried veggies. So there's so many different choices. On my website, drjoe.com, I have a whole lecture that I did called So What Can I Eat? And it's all there. So you don't need to eat a lot. Your body doesn't need a lot of food. It needs a lot of nutrients. And that's what, yes. Sure. Yeah. Well, at your age, 55 years old, I would think that if you really crack down, and if you want to jumpstart it, we have a weight loss protocol that we do, but it's really a cleansing protocol that we do. And you can call my office, ask Michaela, she'll set you up with that. And it's a 21-day cleanse where we really keep strict. You eat really well, and you take a ton of supplements for 21 days. I'm going to guess 3 to 6 months. You should see some dramatic changes in your liver, actually. Yeah. My pleasure. Thanks, Ron. Appreciate the call. All right, so folks, let's see. We'll keep taking some callers. How are we doing on time? All right, we've got about a minute and a half here. Joy, how can we make your day better? Yes. 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 Yeah, well, keep listening. Yeah, right after the break, I'm going to talk about cell phones and Wi-Fi and everything. So keep listening to that. And what's your second question? Well, with stem cells, the Wharton's jelly cells, there's a lot more of them. They take it from umbilical cords, there's a lot more of them. And as you're older, your stem cells are older and weaker. Now, I said that to one of the doctors who uses his own stem cell. You take your own out, and he said, yeah, but the Wharton stem cells, there's a lot more of them, but they don't all survive either. So you can try either one. It's not cheap to do it either way, but if the stem cell research that I'm reading is doing what it looks like it's going to do, it's going to totally blow medicine out of the water. What we know today is going to totally change because of the effects that these stem cells look like. The promise that they have is just off the chart. So yeah, you can use the Wharton stem cells. You can use your own stem cells. Both of them seem to have promise, though. And I personally did the Wharton ones. My pleasure. Thanks for calling, Joy. Keep listening. I'll talk about cell phones, okay? Folks, I'm Dr. Joe Esposito. My website, drjoe.com. If you want to order Super Greens, Essential Source, the B complex. We're going to talk about vitamin D coming up, nitric oxide. All that's on the website, drjoe.com. Hundreds and hundreds of hours of archived radio shows. And if you have a question, the number is 844-44-Dr. which rings through to my offices if you want to make an appointment. We have offices in Marietta, Duluth, and Stockbridge, the Atlanta area, if I'm not on the air. 844-44-Dr. Don't go anywhere. We're going to be right back.
Does this sound like a neck
All
pain,
right.
pain, shoulder pain,
That's me doing a commercial for
chances
myself.
are you benefit from care. Most people
That's
benefit.
me. Okay, more questions.
Is that 21-day cleanse how you eat every day?
The eating part, most of it, yes. No, I don't. And in fact, starting tomorrow, my whole office, myself, Garrett, and a bunch of my staff, we have a challenge. We're all going to do a 21-day cleanse, and we're going to see how we do, how we feel, and then how much percentage of weight loss you have. Now, I don't need to lose a lot. Garrett doesn't need to lose a lot. Some of my other staff members are excited that they're going to lose a ton of weight. They probably will if they do it right. And but I eat a plant-based diet every day, so it's how I live. And you know, at my age, I'm 57. I run circles around the 20-year-olds. You know, it was interesting when I hired Garrett. One of the things he says, I'm really excited working here because I'm tired of working with people that after lunch want to take a nap. And those are people in their 20s. And you said, right, in your 20s, somewhere around, yeah. And I said, well, yeah, I could be their grandfathers, and I'm running circles around them. So, and no wrinkles. I mean, it really does work. Not a gray hair on my body. So this lifestyle really does work. So.
And with the 21-day cleanse, there's a non-vegan version as well.
Yes, of course.
Not everybody at the office is.
Should have said that. You're
daring
right.
enough. Okay, this is one I've never seen. What do you recommend for healthy teeth? I personally have seen a lot on the charcoal.
Just drinking my Super Greens and Essential Source here. Oil pulling. Garrett doesn't know this. I haven't talked about oil pulling in years. Take some coconut oil or sesame oil, extra virgin organic, of course, and swish it around between your teeth up to 20 minutes a day. Don't spit the coconut oil in your sink because it's going to harden in your pipes. Spit it out. Throw it outside, whatever. And oil pulling just rocks when it comes to teeth issues. It gets in between the gums. It's antibiotic, antiviral, antifungal. So oil pulling is just an amazing thing. I had a root canal here. Wish I never did. I was younger. And whenever you have a root canal, you have a low-grade infection for the rest of your life. And every now and then it acts up, and I'll just take some coconut oil, swish it around. I can do about 10 or 12 minutes, and then I got to spit it out. But if you do that for a couple of days in a row, you'll be amazed how well your mouth does. So it's called oil pulling.
Can a pinched vagus nerve make you pass out with heart attack-like symptoms?
Yes.
If so, how do you fix it?
Well, it depends where it's being pinched. Many times it's the stomach, because the vagus nerve comes out of the skull. It's what's called a cranial nerve. So it comes out of the skull. It doesn't go through the vertebrae. It comes out of your skull, runs down on your left side, goes into your digestive system. And so if you have, it's called vasovagal syncope, where the vagus nerve is somehow being irritated, and it can cause you to pass out, get dizzy, and pass out. So if the stomach is up against the diaphragm, if you have bowel issues, you may have to adjust the stomach, get on a good diet, of course. Chiropractic care opens up the nerve supply to the areas, and it helps the body heal. So it depends where the vagus nerve issue is and how to fix it.
What is a good source of vegan protein?
You don't need a lot of protein. Number one question, where do I get my protein? Super Greens and Essential Source, broccoli, cucumbers, tomatoes, avocados, salad. What do cows eat? What do horses eat? What do elephants eat? They eat grass and grains, and not grains, grass and bark and trees. They eat vegetables, and look how big and strong and how long they live. So you don't need a lot of protein. You only need about 8% of your total caloric intake is protein. Anything beyond that is wasted. So a good source of vegan protein is anything that's a plant-based food, and that's a great source of protein.
And what about a vegan milk alternative? What's your favorite? What do you recommend?
I get the one that's on sale. Coconut milk, almond milk are my favorites. I personally like coconut milk. If you get the unsweetened and mix it with Super Greens and Essential Source, it's okay. Some people, the Super Greens and Essential Source, a little earthy tasting, so then you use like a sweetened one. And that's fine. You're going to get so little sugar in there, it's fine. But I usually get the one that's on sale.
And yes,
yes,
Mint Super Greens are in stock in Marietta, Duluth, and Stockbridge.
Yes, the Mint Super Greens. Yes, if you don't know what that is, we have the Super Greens, which are kind of have a green flavor to them, and the Mint Super Greens is a little sweeter and has a mint flavor to it. So if you're a rookie, you might want to start there. And they were out of stock for a while, so Garrett is very happy to report they're back in stock.
All right.
30 seconds. So.
How do you know if you're taking statins? What is a statin?
Statin drugs if you have high cholesterol. Okay, so if you have high cholesterol, you're taking medication to lower your cholesterol. That's the statin drug. Okay? And you should know what you're taking, by the way. If you don't know what you're taking, sit down with your doctors and find out why. I'm always amazed when people come in and say, I don't know what I'm taking it for. Find that out and then get well. Again, I'm not saying stop taking your drugs. I'm saying let's get you well, so hopefully you may not need the drugs. All right, we're coming up in a few seconds here, folks. Got to go back on the air. And so, we have this intimate little thing, you and I, but radio folks, I got to keep them live. Here we go.
He would be the Brad Pitt of radio. That's why you listen to Dr. Joe Esposito on WSB.
Hey folks, Dr. Joe here. So glad we spent a little time together. We're talking today good stuff about statin drugs, pesticides, cell phones, and your heart. So I want to talk about, because somebody called up before and I promised her I'd do this, and if you're on hold, keep holding on, folks. I'm going to get you questions, I promise you. And she wanted to know how the cell phones actually do affect your body. So 2 factors. We talked about the pesticides, and I do want to talk about your cell phones. Your cell membranes have something called a voltage gate calcium channel, a VGCC. And that's where calcium goes in and out of your cells, well, goes into your cells. And it's activated by electromagnetic frequencies like microwaves. When that happens, they open up and they allow massive influx of intracellular calcium, calcium outside the cells, which in turn stimulates the release of nitric oxide. And then inside your cells, the mitochondria, this nitric oxide combines with superoxide to form peroxynitrate. Not only does peroxynitrate cause oxidative damage, they also create free radicals that profoundly destroy the mitochondrial function. So essentially what happens is when you're putting a cell phone next to your body, it opens up the gate and allows the calcium to be in places it's not supposed to be. And that affects the mitochondria, and the mitochondria is the part of the cell that makes the heart beat or the muscle contract. So when the tissues with the highest densities of the voltage-gated calcium channels, one of them is the pacemaker in your heart. Research tells us that excessive microwave exposure can be a direct contributor to conditions such as cardiac arrhythmias. According to Dr. Seneff, electromagnetic frequencies also contribute to arterial calcification, which is blocked arteries, which can affect everything, including dementia. So if you care about your health and you're already struggled with heart problems, here's some advice with cell phones and Wi-Fi. Carry your cell phone in a pocket. Avoid carrying a pocket away from your heart. Now, if you put it in your front pocket, it's near your genitals. Not a good idea, because we don't want to open up these voltage-gated calciums, the voltage-gated calcium channels, and it can affect your testicles. And studies have shown it can actually lower your sperm cell and sperm activity. And because the testicles are on the outside of the body, the ovary is inside the body, little less effect. Excuse me. If you put it in your back pocket, I can't tell you how many patients over the years have come to us as chiropractic patients with back pain, and they say, well, Dr. Joe, as soon as I took my cell phone out of my back pocket, my pain got better. So what I do with my cell phone is I carry it in my hand. When I get in my car, I put it on the seat next to me. In the office, I take it out of my body, out of my pocket. When I'm in my house, you want to put it about 30 feet away, if you can, because electromagnetic frequencies can actually can go as far away as 30 feet. In my house, I shut off my Wi-Fi at night. I have a timer, a little Christmas timer. And what I do is, like a Christmas tree timer, you time your lights on, it costs $6 at big box stores. And I plug my Wi-Fi into it. And at night, right around 9, 10 o'clock, I have it shut itself off. And in the morning, right around 7 o'clock in the morning, it turns itself back on. So I don't have Wi-Fi in my house when I'm sleeping. And I think you should consider that as well. Avoid usable portable computers and tablets that are on Wi-Fi, because you're drawing the Wi-Fi into your body. Turn off your cell phone at night if you can. Maybe put it on airplane mode if you have to use it as an alarm. Turn off your Wi-Fi. We talked about that already. And try to get your cell phone away from your body as much as possible. And when I do live lectures, one of the things I show people is I'll have them step in the audience, and I'll push on one of their muscles, and they'll be strong. And then I'll take their cell phone and just have them hold it against their chest, and I'll push on any muscle in their body 100% of the time. I don't care how big and strong the person is. Every muscle in the body goes weak. So it's affecting the calcium flow in and out of into the cells, and that can affect the mitochondria, which then creates free radicals to form, which can damage the DNA in the mitochondria. Now, you're thinking to yourself, but we're on Wi-Fi everywhere. I mean, I'm in a radio studio right now. Outside this studio, we have monster-sized dishes. I understand that. It's probably not the best thing for you. But if you're healthy, you're less likely to have problems. That's why, because in this age of Wi-Fi and the age of electromagnetic frequencies, it's more important to stay healthy than ever. And especially if you have weak heart and you have weak muscles, these are things you might want to avoid. So it's an issue. And if Judy, if you have a printer next to your bed, I strongly advise you shut off the Wi-Fi from it at night, or move that printer to a way another side of the house if you can. And a lot of people have sleep issues, and they can't